WCCSradio.com.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. It's Tuesday morning, and in the studio with us this morning, see if I get her name right. This is the part I'm worst at. I'm bad at a lot. I'm really bad with names. Dr. Alexis Linnebur is with us this morning.
Yeah, they even said it wrong at my graduation, but you got it right.
Did they really?
They do.
What did they say?
They always add a G. Linnebur.
Oh, yeah?
Yeah.
They turn you into cheese?
They do. They do.
Terrible.
That's okay.
Terrible.
But you did great. Thank you.
You've been in Indiana for how long?
My husband and I just moved here in July.
In July. Our conversation with Dr. Linnebur is presented by Marcus & Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. A specialist in maxillofacial surgery, which we want to know about because there are plenty who have no idea what I just said even.
Yeah, it's a mouthful for sure. But maxillofacial surgery is a subspecialty of surgery. We really focus on the diagnosis and treatment of conditions of the head and neck. We deal with reconstruction for trauma cases, pathologic cases, congenital deformities. We do corrective jaw surgery, whether that's just a teenager who has malaligned jaws, the top and bottom jaw, or somebody who is older and needs correction for sleep apnea.
One of the things we always think of when we hear maxillofacial surgery is cleft palate.
Absolutely. I actually did my fellowship last year at Arnold Palmer Hospital in Orlando, Florida, and the pediatric cleft and craniofacial. So it's my specialty. It's my first love. So we're hoping to give that service here if it's needed.
Yeah, well, one of the things I've always had this question about it because we hear about it all the time with children.
Yes.
In pediatric cases.
Yeah.
But there are actually adults, particularly in other countries, who live with cleft palate and finally either get the resources or have available to them the opportunity to get that fixed. And what a life change it is.
Oh, it's absolutely life-changing, not just for the patient, but also their families. I mean, they have to completely change the way they eat. They utilize speech-language pathologists very frequently, occupational therapists. Their whole life revolves around this, so it really helps them out.
What brought you to maxillofacial surgery? So
maxillofacial surgery is a specialty that, in my opinion, you don't ever get bored at. You never know what's walking in the door. We kind of, have our fingers in a little bit of plastic surgery, a little bit of ENT, ophthalmology, dentistry. We really cover a broad range of topics in the head and neck.
Well, it fascinates me because we're talking about bone structure.
We are. Bone and soft tissue, and so I love that, and especially when I can treat somebody who's a little baby all the way up to somebody who's elderly and everything in between. It really is a nice specialty. People
who need maxillofacial surgery. Do you ever shorten that? Is there ever a...
Yeah. Yeah. So I typically say max face. And I think I told you right before we started, it's actually craniomaxillofacial surgery, and people just abbreviate that to CMF.
All right.
So it's easier.
But I could say max face and sound really cool.
You could. Sound really cool.
All right. So when you're doing max face, the life change obviously is the great benefit from it. The appearance is one thing, but the actual physical changes that people go through. But when you're working with bone structure and soft tissue, I would assume that there's a lot of pain involved.
Yes, there can be. It is, especially in a trauma case, you have the discomfort from the trauma, and then you also have the discomfort from the surgery. However, we have the ability to give people analgesics and opioids if needed to help them through that short phase to get them through, and educating patients and letting them know that they will have some discomfort, but it's okay, and we will get you through that. That goes a long way.
Yeah, but I'm thinking that probably down through the years, you would know this more than I, the technology and the techniques change so rapidly. Absolutely. And it gets better and better.
Absolutely. The way that we fixate a mandible fracture today is not the way they did 20 years ago. There's some nuances that are the same. However, the specialty has come a long way.
Depending upon what the condition is, I'm assuming as well that there are non-surgical options in a lot of the cases.
There can be. One of the things I love about my specialty, though, is that it is a surgical service. So if I do have a patient that comes in and I find out that they fortunately do not need me, which is great for a lot of people, then I can send them back to their dentist or send them back to their primary care, and then they can help manage them through that condition.
Let's talk about the jaw, because that is a problem that we associate with teens.
Yeah.
Do they notice it more when they're teenagers? Does it progress to a point? How is it that it works out that way?
It's absolutely something, especially in today's day and age when social media is so prevalent that people notice their appearance a lot more than they used to. And it is really fortunate that sometimes not only do I catch it, but the orthodontists and the primary care physicians and even the dentists in the town will notice it. And usually that's when the conversation starts, and then the patient's referred to me and I get to have that actual conversation with them, like, this is our option and this is what we can, and then the patient and their family get to decide.
I would assume as well, see, I make a lot of assumptions. I would assume as well that there is a lot of wear and tear if the jaw is not aligned right, and maybe even erosion of a joint if someone is not constructed properly.
Yeah, it definitely can be a functional as well as aesthetic, downside to not having your jaws aligned. People live with it just fine and there's no issues. Some people do have jaw pain. Some people have the wear and tear of their teeth, like I said, but the dentist can help them out with that.
Yeah. We hear of things like click jaw, too.
Yeah, it's actually, it is a form of normal. A lot of people actually have clicking and popping in their jaws. They don't have pain with it. And some people don't have clicking and popping, but then we have some degeneration of the joint. So it is it's a very interesting joint up there. We don't really know what goes on half the time.
Dr. Alexis Linnebur is with us here this morning. We're talking about maxillofacial surgery.
Maxillofacial surgery.
Which is her specialty. So you come to Indiana Regional Medical Center. How did you ever find us?
My husband and I, we really did interview from coast to coast. We looked at all different options. However, we settled on Indiana because we're both from really small towns. We knew there's needs in small towns. We wanted to raise a family in a small town. And we really did see IRMC as a place where we both could have a really nice career here while we start a family.
Describe for me your first impression when you came here and you saw IRMC and when you saw the whole town for the first time.
To be very honest with you, I thought when I was talking to the physician recruiter that I was interviewing for the state of Indiana until I saw the plane ticket.
Yeah, everybody does that.
But no, it was a very beautiful town. We got to know the beauty of, slowing down and really just appreciating what's around us.
The facility itself. Tell me about that. I assume, well, you're coming from Arnold Palmer in Orlando, so that's top of the line stuff there.
It is. It's a busy, busy top of the line place. Yeah. So my clinic will actually be on the third floor of the surgery center. We're building that now, so we have all new state of the line equipment and technology that we'll be able to offer patients. And it's a really beautiful facility, and I'm very excited for people to eventually see it.
So you're here in Indiana for the first time, and basically there's not this service available here at IRMC. It's pretty exciting for folks to understand that that this is now getting off the ground, and you're there right at the ground floor on the third floor.
On the third floor, on the ground floor, yeah. So in our clinic, we'll be able to do sedations or locals, whether that's any kind of soft tissue or bone graft, do wisdom teeth, do implants. Someone that might be a little bit more medically complex or needs a larger surgery, we have the option to take them to the surgery center, and then even further offer them the option to take them to the operating room.
Do you generally get patients by referral, or can people just come to you?
Yeah, so we are a completely referral-based service. They have to have a referral from either a dentist, orthodontist, anyone in that specialty or their primary care or pediatrician.
Yeah. I would imagine, therefore, that there's a bit of an educational process for all of those medical professionals
Yeah.
to have them understand that now this is a service that you might have sent someone to Pittsburgh for or to some other facility in some other big city, that now it's available here with an experienced surgeon.
Yeah, which is something that I hope that I've been able to meet people along the way, and hopefully people hear this and, just know that we're here and we want to help. People always have the option to go to Pittsburgh. They have the option to go anywhere, but, I care about my patients, and I love that I can offer them this service at home.
Wonderful. It's so good to meet Dr. Alexis Linnebur with us here this morning. Where do you get an education in your specialty?
I kind of went all over, mostly in the Midwest. I was at the University of Kansas for my undergrad. Then I went to Illinois, where I went to Midwestern University. I did my residency at Carle Foundation Hospital in Champaign-Urbana. And then I did my fellowship in Orlando, Florida.
You are a Midwest girl.
I am. I'm a Midwest girl at heart.
You're a Jayhawk
I'm a Jayhawk
as well.
And dare I say I am a Chiefs fan, born and raised.
Well, that part you didn't need to add.
I had to put it in there. I had to. I got to be true to myself.
People back home, they'll see this video. I understand.
My family would be proud.
So, a husband?
Yes, I have a husband.
No children yet, but plans.
Yeah, we have. We actually have 2 puppies, and that is taking up a lot of our time. So it's good practice.
Well, you got kids then.
We got kids. We call them our kids.
Wonderful. So good to meet you.
Yes, you too.
And looking forward to hearing more from you. And folks are going to be able to be introduced to you through the services that you offer. It's a wonderful thing that IRMC is making this happen.
Very lucky.
And you're right there at the beginning.
Yes, I'm excited and I'm ready.
Terrific.
Yes.
Dr. Alexis Linnebur with us here this morning. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. 24 minutes after 8 o'clock, and it is a Tuesday morning, Tuesday, September 24th. Raining outside. We're on the way today to 68, mostly cloudy with a shower and a thunderstorm. Jake is in the newsroom. He's back with us. Boomer Sports next. It's Indiana in the Morning on WCCS.
This is Boomer Esiason with the Sports Minute, sponsored by WeatherGuard Truck and Van Equipment. They're just as driven as the hardworking pros they serve. Rutgers quarterback Ethan Kaliakmanis has led the Scarlet Knights to a 3-0 start. During Saturday's victory at Virginia Tech, Kaliakmanis vomited while running to the sidelines. His explanation? Coach Ciano tells us to leave it all in the field. I'm Boomer Esiason.